So I want to put to rest all of the comments that you made. So this is what because you made several comments, all just narrative. It's not the facts, but I'll show you the facts so that maybe you can rethink how much you believe all of this that you're saying. Single payer healthcare would reduce cost by half with better outcomes. No, you will pay massively through taxes, and the government doesn't give you anything for free. Yeah, and on top of it, you will not get care, not unless you never get sick. If you never get sick, then you're fine. I will back that up with data in a minute. And then you went on to say Great Britain has had it since World War II. Yes, and most nurses can't stand it that are in the NHS. Most people hate it too. That's why if they can't afford it, they flee here to America to try to get treated because they wait forever there. I'll bring you the facts in a minute. What's wrong with socialized medicine? Everything. Trump's healthcare would be to go back to privatized medicine in which profits over people. No, excuse me. Remove Trump from this for a minute. I remember what healthcare was like before Obamacare. That's when we put patients first. Now, no, it's all about profits. There's not even a place we put patients on the list. Truth, absolute truth. So, and then you say all other industrial nations had universal health care, and it is at half the cost of our healthcare system. So what is the problem? Well, let's start here. I'll give you the facts of the evidence, since the mainstream media, who's always wanted to push this lie, doesn't want to speak the truth about it. So yes, this is just the facts. Socialized medicine is a failure everywhere it's been tried. In terms of both availability and quality of care, single-payer systems leave citizens out in the cold. I'm really not sure why people don't understand. It's like socialism in countries. People believe we're going to do it differently. No, it's been tried over and over again. It fails. So, let's see. Wait times in countries with socialized medicines are atrocities. Oh, are they ever? Like I said, don't get sick. You better not, hope you don't get sick under socialized medicine. So in the United Kingdom, the figures show that a total of 3.7 million people in the UK are now on the waiting list for non-urgent operations, up from 2.4 million in 2008. More than 360,000 of them have been on the waiting list for more than the minimum waiting time of 18 weeks. Equivalent to 1 in 10. It means that 1 in 14 people living in England is now on an NHS waiting list. Citizens in single-payer systems are regularly denied procedures or wait for months for them. Also, stats for the United Kingdom data shows that older patients are less likely to receive surgery for cancer treatment than younger ones. A 2011 report noted that only 39% of women over 80 in the UK receive surgery for breast cancer compared to 90% of women under 50. That's a Macmillan Cancer Support Summary of study by the National Cancer Intelligence Network. More than 80% of the older patients in the UK believe they suffer discrimination from the National Health Service. Yes, because socialism almost always goes hand in hand with being racist. And it has nothing to do with skin color. They're racist at anybody who doesn't have all their money. It only serves the wealthy. In Glasgow, Scotland, the Queen Elizabeth University Hospital is so overburdened one day this past January, it had to turn away 3 women who were in labor. In a hospital in Essex, doctors twice canceled a potentially life-saving surgery for a patient with esophageal cancer because there were no free beds in the intensive care unit. In Wales, an 82-year-old woman who had fallen waited 8 hours on the floor before an ambulance arrived. Her daughter sat beside her during the ordeal and described it as one of the longest nights of my life. Canada's stats, specialist physicians surveyed, report a median waiting time of 20 weeks between referral from a general practitioner and receipt of treatment. longer than the wait of 18.3 weeks reported in 2015. 2016's wait time, the longest ever recorded in this survey's history, is 115% longer than in 1993, when it was just 9.3 weeks. Denmark, the average wait time in 2014 was 83 days for cataract surgery, 55 days for hip replacement, and 59 days for knee replacement. Again, this was 2014. I'm sure it's off the charts now. Norway, the average wait time in 2013 was 128 days for cataract surgery, 154 days for hip replacement, and 183 days for knee replacement. Sweden fell from 4th to 13th richest nation in the world between 1975 and the mid-1990s. Annual working hours in Denmark fell by 32% between 1950 and 1990. Between 1950 and 2000, Sweden's net job creation in the private sector was 0, despite a population increase of 2 million. Wealth inequality in Sweden exceeded that of the UK, US, and Canada in 2008. Although Britons do have affordable access to primary care doctors, and everyone in the UK is covered through high taxes, they are subjected to extensive waiting periods for specialist surgeries and hospitalization. The fact is that many patients die waiting for treatment. Rather than rejecting the basic free market principles of the U.S. economy, a 2016 Harvard University survey found that most do. Young Americans would do well to ask themselves why it is that so many people from countries with socialized medicine flock to the United States for treatment. According to a recent Pew poll, support for universal health care provided and paid for by the federal government is higher among American millennials than among other groups. Young Americans seem to believe that socialized medicine is a cure-all for healthcare ills in the United States, as it is elsewhere, such as Canada and Britain. Unfortunately, there are facts that would appear to put this fantasy to rest. By the facts, for instance, the tragic and untimely death, yes, of a college-age student who didn't go and get treatment for an ear infection because she couldn't pay for any prescriptions. You guys seem to think that it's just free healthcare. You never have to pay for anything. No. You have to pay for the extras. You have to pay for the referrals. You have to pay for those big prescriptions you get. Yep, nothing is free. Quit believing the socialist communists that are trying to trick you into this nightmare. The sad reality about the field of medicine in a former communist country such as Romania is that old habits die hard. Having grown up in communist Romania, I remember after feeling ill being taken to the polyclinic to a room full of other sick people, all entitled to free care. Some were there to receive permission slips to miss work due to their ailments. Others were there for injections. Still others were so ill that they could barely stand, and yet the system was first come, first serve. You know, that's pretty much what we have now. Yeah, people come to the emergency room just to get a doctor's note. They come to the emergency room to get a prescription refilled. Yeah, that's what Obamacare's done. Moving to the United States, where doctors were paid on the basis of merit and hard work, not according to a bogus ideological equality imposed by central omnipotent government and its bureaucrats, was a blessing American millennials, a majority of whom seem to believe in ideological social experiments that may have failed broadly elsewhere, have no clue about the literal and figurative bitter pill that people living under socialist and communist regimes are forced to swallow, not only where healthcare is concerned, but also where government is concerned. Yes, socialized medicine is what we have. It's why patients aren't put first. It's why we have poor outcomes and quality of care is in the toilet. Universal health care, well, you'll be paying through the roof for that. Talk about more than half of your check will be taken, and yet you won't have quality of care at all. It will be diminished and be ugly. good luck with this thinking.